Okay, in this video, it's going to be kind of an interactive game. I'm going to put a rhythm up on the screen and only give you 5 seconds to look at it. Within 5 seconds, you should be able to kind of start differentiating some of these special or hallmark findings between AFib, a flutter, or a potentially sinus rhythm. So I wanted to be cautious not to put sinus rhythm because in order to really confirm a sinus rhythm, you absolutely have to go through your full 6 steps to interpretation and measure all of your intervals and waveforms to make sure it all conforms to the normal limits. But just based on kind of pattern recognition alone, you should be able to start differentiating between these 3 very common rhythms with quick rapidity and very high accuracy at the paramedic level. So obviously you always want to be cautious, not to jump to conclusions. You can have your interpretation in mind, but always take the extra 30 seconds and go through your interpretation steps to confirm your suspicions, especially before submitting a test answer. All right, with that being said, let's get started. Here's our first rhythm. I'll give you 5 seconds. AFib, a flutter, or potentially sinus. And this rhythm is an A flutter. So when you're looking in between those QRS complexes, you do see nice, tall, pointy, repeating pattern that is consistent with a flutter wave. Rhythm number 2, AFib, a flutter, or potentially sinus. This one is a potentially sinus rhythm, so you can see clear, distinct differentiation between what could be a P wave and what could be a T wave. Yes, you do have some extra squiggles in there. That's probably artifact. Go through your measurements to confirm your suspicions. But this is potentially a sinus rhythm. Rhythm number 3, going to start going a little bit faster now. And this one is an irregular rhythm with no identifiable P waves and no identifiable flutter waves. This is atrial fibrillation as your chief suspicion. Always walk through your steps to confirm. Next rhythm coming up. Remember, if you need more time to practice and you want to, just hit pause right after the rhythm shows up. With more time and more practice, you'll get better at identifying these rhythms within a couple of seconds. Answer coming up if you need to pause. It is a potentially sinus rhythm. So again, you can see discernible P waves, discernible T waves. Even though it's irregular, you would not call this AFib at first glance. Next one. And the answer is a flutter. So again, you can see those very distinct flutter waves. They have just such a unique shape to them. You should be able to identify them right away. Answer coming up, potentially sinus. So here it does look a little bit irregular. It's hard to see those P waves, but you definitely do not see flutter waves or fibrillation waves. So even though it's irregular, you're not seeing something that tells you straight away, I should be thinking one of those dysrhythmias. Next one coming up. Did you say a flutter? If so, that was the correct answer. So again, this is a sloppy looking rhythm. We definitely have patient movement creating some artifact, but we can see those flutter waves in between our QRS complexes. So watch for those flutter waves. They're very easy to spot. All right, next one coming up, nice and tricky. You guys are getting better. You're ready for it. Did you say potentially sinus because those look like round upright P waves? Okay, I can see your brain, but do we usually have 3 P waves before every QRS complex in a sinus rhythm? Absolutely not, we don't. This is a weird variation of an atrial flutter, so we have multiple atrial depolarizations for every QRS, every ventricular depolarization. This is an atrial flutter. All right, here's your next challenge. 1, 2, 3, go. Hopefully you said atrial fibrillation. So even though it's a fast rhythm, kind of looks regular, you can see those fibrillation waves between the QRS complexes. That should have been easy. Next one coming up. Did you say potentially sinus or atrial fibrillation? Which way do we go? Which way do we go? I don't know. So this is a hard one because you don't see those strong fibrillation waves, but it is an irregular rhythm. If you were watching this rhythm progress on a monitor, you would see that heart rate going up and down and kind of all over the place. Atrial fib would be my first suspicion, but I would go through my steps to confirm that. So I would call this an atrial fibrillation, not a sinus rhythm. I cannot see any P waves. All right, next one and our last one of this challenge. Hopefully you said potentially sinus. So again, you can pick out those P waves nice and easy, at least on some of the beats. So at least on some of those beats, you believe the SA node is the primary pacemaker of the heart. And that concludes our rapid fire game of AFib, A Flutter, or potentially sinus. Have a great day.